Okay, today's morning medicine is Calcarea sulphurica. It's very interesting. This is gypsum, or what's that board called? The stuff you build houses with. But it's sulfate of calcium, which is gypsum. What is that called? Something board. Oh well. Anyways, but gypsum is anyway what they use for. God, I can't think of the name of it. Anyways, Calcarea sulphurica is closely related to hepersulf. So hepersulf is another one that is got all the yellow mucus and things like that. Calcsulf, which is an impure sulfide of calcium, but has a wider sphere and deeper action. So it had Calcsulf has a wider range of healing different issues, and it has a deeper action than hepersulf. So when you have that yellow, whether it's pus coming out of you, yellow mucus, yellow diarrhea, yellow stuff coming out of you, you would think of Calcsulf, you'd think of Natsulf. These two would be the medicines you would think of, and especially in suppurative processes. So if you have an ulcer, a skin something or other, and it's suppurating, or pus is coming out and it's yellow, you would think of Hepersulf, Natsulf, yeah, Hepersulf, Calcsulf, Hepersulf, sorry. It is Dr. Schulzer's connective tissue remedy. So helping with the tissues to connect them, heal basically, and that's in cuts, bruises, cuts, injuries, any kind of thing like that, and especially something with pus coming out. And most of its indications for its use are derived from his clinical experience. So most of it's not from provings as much as it is from actual patients that he took care of. In the last edition of his biochemic therapy, so biochemic is just what food and everything does on the chemical level of the body. Schulzer discards Calcsulf because it is not an actual constituent of the tissues. So it's not actually made from the tissues. So he discards it in the biochemical range, and he distributes its function between silica and nat phos. So with repairing injuries and stuff like that, silica and nat phos, very good for all that. Any kind of injuries and eruptions or suppurations, pus coming out, he discards it in that, whenever you're trying to heal a wound. And the real healing one will be tomorrow. What's today? Thursday. Yeah, Friday, which will be calendula. That one heals greatly. But with pus coming out in that, which can be sepsis happening, different things. You can even have internal pus of the kidneys in different areas, internal suppuration or pus coming out of organs and things. You would think of Calcsulf, and of course nat phos and silica. So being that Calcsulf, you don't need to know all this to utilize this medicine. You just need to know there's pus, there's yellow pus, suppuration. You have an injury that gets infected, we'll say, and it starts pussing in that. You'd think of Calcarea sulphurica, and you think of nat phos and silica for these type of situations when there is pus coming out. There's a few other ones, but homeopaths having no biochemic theory to support it. So they don't have the biochemical, the actual chemistry behind it, we'll say, may continue its use without scruple. So they still can use it, even though they don't have the chemical backing behind it, especially as it has been proved by Herring and others. Herring's a top homeopath at that time. It is indicated in all kinds of cases after pus has found a vent, or they call it suppuration, or just you have a cut and it doesn't heal right and you have pus coming out. So Nash, another homeopath, he's got Nash's, do I have that over there? Nash's Leaders, which talks about, it gets deeper into the homeopathic realm, has cured a case of suppurating kidney. So how do you know a kidney's suppurating? I don't even think back then they had that many, all those tests, that they could do, MRIs, all that kind of stuff. They didn't have that back then, I doubt. It differs from Hepersulf in its sensitiveness to air. So Hepersulf is very sensitive to air, and Natsulf or Calcsulf once likes the open air. Hepersulf cannot bear the slightest exposure to air. Calcsulf has better in open air, better walking in it, desire for it. Both have worse from change of weather. So that's a similarity there, but the difference is one likes the open air, one can't take it, which is Nat Foss, or Hepersulf, sorry, doesn't like the open air, but Calcsulf does. And that's how you differentiate. So you're looking at pus coming out, it's yellow, you got Hepersulf, you got Natsulf, you might think of for the healing silica, Nat Foss, and you can think of calendula, but when it's suppurating, you want one of these other medicines like Hepersulf and Calcsulf. And Hepersulf is great for colds and flus that have mucus coming out like that, and so is Calcsulf. Has not the excessive sensitive to touch found in Hepersulf. So Hepersulf doesn't like the open air, they don't like touch, where Calcsulf is indifferent to touch and it loves the open air. So that's how you would differentiate, which is more like the modalities. Better in open air, bathing, eating, all that kind of stuff. Worse in drafts, touch. So Hansen recommends it in dry eczema in children with cystic tumors. So any kind of tumors that are cystic, fibroids, polyps have been cured with Calcsulf. So any kind of, woman has them fibroids, you might want to consider Calcsulf. There's a few other ones, the polyps and all that kind of stuff. So it's good for psoriatic, which is skin. That's a skin miasm, mainly, and allergic constitutions. Okay, so Calcarea sulphurica, tendency to suppuration. So any cuts, wounds that don't heal, and they have pus coming out of them, basically. You would consider Calcsulf. Mucus discharges are yellow, thick, and lumpy. And that's the same thing with Hepersulf. Hepersulf has that. So does Calibic, and there's a few other ones. These are all threes. That suppuration, that yellow discharge. And the yellow discharge can be, from the nose, the sinuses, the cuts, the wounds, the eyes, different things like that. Better in open air, unlike Hepersulf, they don't like open air. Bathing, better eating, worse from drafts. So they do like the open air, but drafts bother them. Touch bothers them, but Hepersulf, it really bothers them. They're highly sensitive to did I say that right? Hepersulf? Yeah. They're highly sensitive to touch, and drafts. But this one, they don't like drafts and they don't like touch as much. Cold, wet weather, and worse in a warm room. So they can't take the warm room. They can't take cold, wet weather either. And there's a few medicines that have that modality, they call it. Meditates over imaginary misfortune. So they just sit there and muse over all the misfortune, what's going to go wrong, whether it's their health, their money, their whatever, something's going to go wrong. They just meditate over it. They're hurried, very hurried people, very excitable. There's a few medicines that have that. Grumbles that his value not appreciated. So they're always moaning that they're always doing everything and they're always working and nobody helps. And there's, so somebody that has that mental aberration, you would want to consider Calcsulf. Nobody appreciates me. What's that comedian? He says, no respect. I get no respect. Rodney Dangerfield, an old comedian. No respect. This would be a Calcsulf picture. Pain in right side of pelvis, so that could be sciatica, followed by weakness. So they get that pain in their pelvis and it gets weak there. They can't walk from it. Nausea, pain in stomach. So that's, they just get this nausea and the pain in the stomach. Why that isn't over in the stomach, might be some over there. Back, nothing in the back. Chest, no chest, right? Yeah, so no back, no chest. Deafness with A with discharge from middle ear. That got wiped out a little bit. Deafness with discharge from middle ear. That's otitis media, what they call it, with blood. So there's blood coming out with a discharge. There's that pus again. Should be a yellow pus coming out with blood. Flow with dark wax. So they have a flow with that dark wax coming out. Pimples around the ear. And of course, after a slap, after they get an injury to the ear, they get that otitis media. So the eyes, inflammation with discharge of thick yellow matter. That's a 3. So there's that thick yellow matter again in the eyes. Thick yellow matter anywhere coming out. You would consider calc sulf. And of course, hepersulf. But thick yellow matter coming out of the eyes. Doesn't say, oh, and conjunctivitis, any kind of conjunctivitis with a yellow matter coming out. You would consider calc sulf. There's quite a few medicines for conjunctivitis, and you'd have to use some modalities and things to choose which one would be better. Pimples and pustules on the face. And herpes, which is what we call cold sores. So, which is basically a herpes simplex, unlike what's that called? Shingles, which is herpes zoster. So the herpes discharge infection is inside our body a lot, and it comes out on the lips. Nat Murr has a lot of that. If someone has cold sores, you would always gets cold sores. You'd consider Nat Murr. Every time they get sick, they get a cold sore. Herpes zoster, they say it's from chicken pox. I don't know, but is chicken pox a herpes disease that came out? I don't know, but anyways, herpes zoster is shingles, and that's what the infecting agent is. Menses are late, long-lasting with headache. So the woman has a headache every time they get their menses. It's long-lasting, comes on late, and in between they have a thick white leukorrhea. So the leukorrhea is white with this lady's situation, and cutting pains in the right ovary. No food stuff here. Scald of head of children. And what is a scald? Scald head is crusts and infections and dandruff, and they basically got an infection going on up there in the head. And it has yellow discharges. This scald head has purulent yellow discharges, or they have yellow crust. So the discharge comes out, it's yellow, it heals, and it becomes a yellow crust on the head. Heart nothing, kidney pyelitis, which is inflammation of the lining of the kidney, and chronic nephritis, which is inflammation of the kidney. And as we've seen with the kidney, they have a suppuration that could be happening. This inflammation of the lining, inflammation of the kidney, and eventually it can suppurate. So how do you tell they have inflammation of the kidney? The urine is, they have urine problem, a lot of urination going on. The urine changes color. There's pain down there, all that kind of stuff. Burning, itching of soles of feet. That's a 3. So somebody has, that burning and itching down in the soles. You would consider calc sulf. Foot sweat is foul and cold. So it's a cold foot sweat. So it's not so much from heat, but it's very foul smelling. And there's a burning and itching going on with it. No liver, lungs, choking, croup cough. So they have this croupy cough that chokes them. Cough with purulent and bloody sputum. Should be yellow too. But anyways, lots of mucus, and it's bloody. Hectic fever. Hectic fever is a high fever and a low fever. It gets high and then they get the chills. Very high fever, and then the temperature goes real low. Empyema. What is empyema? I gotta look that up. But there's pus forming in lung or pleural cavity. So there's that pus again. Empyema. Let's see. I don't know why I didn't look that up and write it down. I probably looked it up, but I didn't write it down. Empyema. Empyema is what it is. Emma. And this is what you can do. Is it necessary to know that? Probably not. Empyema is a collection of gathering of pus within a naturally occur. Okay, so it's just pus forming in the lungs, and and that I guess that's why I didn't write it down because it says pus forming in lungs or pleural cavity. So there's that pus again in the lung. That's what they're calling empyema, which just a medical term. Why, I mean, it makes it easier than the doctor always having to say pus forming in lung or pleural cavity. So there's the pus again. Any pus, any suppurating pus, calc sulf would be definitely considered along with hepasulf. Catarrh with thick, lumpy, white, yellow mucus, or pus with blood. So it can be either thick, lumpy, white, yellow mucus or pus with blood coming, they're coughing, they're having come out of the lungs. And that's from that, that pus forming in the lungs. So this thick yellow stuff is also a hepasulf situation. If I see someone coughing up thick yellow stuff, I can think of Cali-Bic. I can think of hepasulf. Few different remedies have that, but that thick yellow, thick lumpy white yellow mucus coming out, calc sulf, and pus and blood can be coming out, and that's definitely from that empyema, which is pus forming in the lung and pleural cavities. No mouth, inside of lips are sore. Tongue is flabby, like dried clay. So it's a big flabby tongue. Sour, soapy, acrid taste. So there's a sour taste in the mouth. And a yellow coating at the base. So there's that yellow again. And that's probably got to do with the kidney stuff. Anytime you look at a tongue, that yellow, if you see yellow on there, they've probably got some kidney things going on. Nose, cold in head with thick, there it is again, thick yellow purulent secretion. So these are any kind of colds, any kind of infections, sinus infections and things. They would have yellow purulent. Purulent just means lots of mucus, and yellowish discharge from the nose. Especially the yellowish discharge is purulent from the front of the nose and yellowish discharge from the posterior sinuses. And that's going down into the lungs and that, into the throat, and they're hawking it up and coughing it up, this yellow discharge, and there's a yellow discharge from the nose. So this can be in sinus infections, colds, flus, pneumonias, whatever's going on. COVIDs, painful abscess of anus. So they got abscesses down in the anus. That's a 3. There's a few of the medicines that could be. Diarrhea in children with discharge of bloody pus. And it comes on from sugar. And that sugar is, they're talking about, what's the maple syrup sugar is what they say in the book. But I would imagine any sugar brings on this diarrhea for these children. And it's got blood in it and pus in it. And any change of weather. So from the sugar or the change of weather, they get this diarrhea and bloody discharge. Unhealthy cuts. Now this is a big one. Unhealthy cuts of wounds, etc. Wounds, pustules, any kind of stuff like that is unhealthy and is pussing and suppurating, and it would not heal. So these things don't heal. Anything that doesn't heal. Now calendula I'm doing tomorrow. Calendula is a great healing agent, but first you might want to consider calc sulf if you let it go, and it's so you get a cut right away. I put calendula on it. That'll heal that thing quickly. And I did that with my son when he slid into a base, and there was a spike. They were playing in a parking lot, and they slid into a base, and a spike was sticking up, and it cut his leg about that wide and about that deep. And it was really deep and wide. So I ran him to the emergency room, and the doctors sewed it shut. Brought him home, and it started pussing, and at that point I was, I'm working a marble restoration company, and I'm doing, a lot of things. And so I thought, okay, the doctors will take care of it. Now I didn't start putting calendula or anything on it, but they said, it started pussing. So I could have considered calc sulf for that, but they cut it back open, brought him home. They put gauze in it, and I forget what they use. What's that stuff called? Anyways, they thought I would put in. I forget what the stuff's called that they use to keep it from being infected. You got to pull this uh, gauze out and repack it. And this was a pain because the kid's like, "Oh no, Dad!" I had to try to distract him and say, "Oh, son, it's so," and rip it out, hurry up and rip it out. And then, what I started doing is I had a calendula uh, paste or cream. It's in like a beeswax. So the calendula was in beeswax, and I basically put it on the gauze, and then I would stick it in his leg and put the bandage back over. Then I'd have to do it again the next day and the next day. So I don't know if it was a week later or so. I took him back to the doctor, and they looked at it and they said, "Wow, this thing's healing amazingly quick. I don't know what you're doing, but keep doing it." And I should have told him right then, I'm using calendula. Might have got them ladies onto another track, but most likely not, because the allopathic medicine has suppressed any kind of natural stuff. You have to use our stuff because they can control it, and they can't control calendula because it's marigolds and they grow right out in the thing. You can make a salve out of it. That's what I was looking for, a salve. You could make a salve out of it. You can give it internally, all that kind of stuff for healing wounds, even internal wounds. You give it internally. And then you can give it homeopathically, which will help the body to heal any wounds or injuries or things that you have externally or internally. So, anything that would not heal and it has discharges of pus or anything like any kind of yellow pus coming out, you would consider Calc Sulph. But once you get the pus and the infection or the sepsis or anything like that under control, you would consider calendula for that wound to heal it quickly. Any yellow scabs, the thing would have a yellow scab on it. Bleeding when scratched. So any kind of thing that causes this itching. Now sulfur has that, that scratching. They itch and they scratch. Oh, sulfur is burning. This one is bleeding when scratched. Interesting. Dry eczema. So any kind of eczema anybody has, you would consider Calc Sulph as one of the remedies. There's a few of them for eczema, so you'd have to determine with other symptoms that you would get, you would have to determine which one would be best for this dry eczema. In their sleep, they start like wanting of air. So they, in the lungs, choking croup cough, and this pus forming in the lungs, so that they're having a hard time breathing. So they wake up and they want their air. Now, can this be in, what do they call that? What do they call that? No, not dyspnea. That is air, wanting of air. But at night when they can't sleep and they got to put that mask on, it is called. Can't think of it right now. But you know what I'm talking about. They fall asleep and they can't catch their breath, and it wakes them up, or they stop breathing. That is. And then they have wear this mask with all these tubes and that. You might consider Calc Sulph for this wanting of air, and there's a few of them that you can get through that. Now, of course, your diet and losing some weight, because all that weight on your stomach doesn't help. So you might want to consider, what you're eating, how you're eating, and what you're doing there. Let's see. Okay, so there's no stomach, no stool, no teeth. We did some stomach with the abdomen. The abdomen was nausea and pain in the stomach. So they could have nausea with pain in the stomach. What's that from? Could be mostly anything. Okay, so the real thing here is the temperature. Hectic fever, which is, like I say, a real high fever, and then the temperature goes real low. Then it'll go real high again and real low. And this can be in, anything, a flu, a cold, pneumonia, COVID, infections, sepsis, could be all that stuff. Caused by pus formed in the throat. So any pus in the throat, and that can be tonsillitis, that could be a lot of different things. Aversion to covers when cold. So they're very cold, but they don't want the covers. And this can be in that hectic fever and that. Dry heat at night. So they have this, they're not sweating. Well, they easily sweat, but they have this dry, I don't know what a dry heat is, but they're very hot at night and they sweat easily. Sulfur is very hot too at night. Worse from a cough with hectic fever. So they have that fever with the cough, and that's probably the croup. Could be bronchitis. It could be a lot of different things. But they have this croup cough with this hectic fever, and they have burning in the soles of their feet. So the feet are they'll kick off the covers and want their feet out of the covers. Throat, last stage of ulcerated sore throat. So any sore throats that is ulcerated, any kind of sore throats, and it's the last stage, calc sulf. So you try some medicines for the sore throat, and it's, really bad now, you would consider calc sulf to overcome that, especially if it's ulcerated. With discharges of yellow matter. So this throat would have, of course, again, the sore throat would have yellow matter. So it can affect the throat, it can affect the lungs, it can affect the eyes. You can have the nose. Where's the nose? The nose can have that thick yellow stuff. The anus, it could be diarrhea, can have that yellow, what was it? No, there's no yellow in the anus. Well, anyways, but a lot of yellow discharges, whether it's, like I said, an injury, the eyes, the nose, the lungs, the throat, all these different discharges that are yellow, you would consider calc sulf. And, if you think about it, when you look at volcanoes and that, when that stuff comes out and it dries, the sulfur is yellow. So that's like what they call a doctrine of signatures. What is Heppersulf? Heppersulf is I think it's a plant. What is Heppersulf? Calcium sulfide. Interesting. So that's just another substance that's yellow. It's got the sulfur in it. So, and you think of plants that are yellow. What plant is yellow? Trying to think of some yellow plants. So the doctrine of signatures is they would look at a plant and think there's one, I forget the name of that plant, but the root, you cut it and it looks like blood coming out and it's good for blood. So a lot of these things they would just observe and they would say, wonder if that's good for this, the starfish, they grow back limbs, you cut their limb off, it grows it back. That's good for, injuries like that, things that, that kind of a situation anyway. So there's a lot of things that you look at. Yellow, sulfur's yellow. Well, all these yellow discharges it's good for. That's why Heppersulf, Heppersulf and calc sulf have all the yellow mucus and yellow stuff coming out. I'm trying to do too much with this. Anyways, superating stage of tonsillitis. So that the tonsils have pus coming out, and you'll see this yellow discharge coming out. When abscesses is discharging of the tonsils. So the tonsils anything that has an abscess, that has discharge, has pus coming out, you're coughing up pus from your lungs, you have yellow conjunctivitis, you would think of nose, you got yellow mucus coming out, going down into the posterior sinuses, your skin, you get a cut and it doesn't heal and it pusses and it's yellow pus. You got yellow scabs and yellow pus coming out of the scalp, so any of this kind of stuff, you would right away consider calc sulf, Heppersulf. There's probably a couple other ones, but those are the two that they mentioned. Now, with the skin stuff and, well, there's no, I can only get into so much here. It's only a half hour and, you come into the community and then that's when I can really go deeper. But to go deeper doesn't matter. My goal is to get this into your hands so you can say, oh boy, my kid's got this cold and all this mucus and it's yellow and thick. And, if my cat, instead of it had thin mucus coming out, allium cepa is a lot of thin mucus. If I would have seen thick yellow mucus coming out, I would have thought of calc sulf. Now, or Nat's Heppersulf, I would have thought of that. Yellow mucus, I would have thought of that. So this is how you think about it, and it can be quite simple to do these, to utilize these medicines. Some things can be tricky, but most things is, when it becomes tricky is you're prejudging. You're saying, oh, I know it. medicine this is. I know what this is. Instead of sitting back and saying, what's really going on with this person? What might they need? And matching the medicine. So, and that's my goal. And to get people, when they come in my free community, we can sit down and, you can learn a basic handful of medicines that will work for a lot of things. Arnica, calendula, arnica for any injuries, head injuries, hypericum. You smash your finger in the door, you give them hypericum, that pain goes away. My kid got hit with a baseball. I'm giving in a lip, and it's all busted open wide, and he's crying, and I'm giving him arnica because it's a hit, it's an injury. I said, wait a minute, that's nerves. I gave him hypericum, quit crying immediately, had him back on the field. So that's how, I prejudged that. I said, arnica, a hit, instead of saying, where's it at? What's going on? Oh, it's nerves, hypericum. So when you come into the community, you learn a basic set of, I'm putting together an emergency, um, like course basically that you could learn how when emergency comes up how to take care of it. So, and that's my goal, just make it as simple as I can for everybody to come in, start utilizing it for their family. And that's because that's what I did. I'm not a homeopath. I don't want to be a homeopath. I want to teach people how easy it is, how easy and inexpensive it is to use, and safe it is to use homeopathic medicine for your family for different injuries, illnesses, things like that. And from there, people that want to go deeper, I can show them how to really get into this. And then if anybody wanted to be a homeopath, which we probably could use a lot of them, there's all kinds of schools I could tell you where to go and become a homeopath. So, all right, that's morning medicine. You can age, but you don't have to get old, depending on how you eat, your stress level, and how you move.